The January COVID surge, is it ending? Joining us to talk about your health is Dr. Greg Schrank, hospital epidemiologist at the University of Maryland Medical Center and assistant professor of medicine at the University of Maryland School of Medicine. Doctor, it's been 4 years now that we've been talking about COVID. You and I, thank you for being here, by the way. We have tests, we have drugs, we have treatments. Yet it persists, and we just had a surge again. What are you seeing in your practice?
Yeah, I remember almost around this time, 2020, we sat across from each other talking about those first few cases.
Customer.
That's right. Yeah. A lot has changed since those early days. We are no longer seeing hospitals overwhelmed by COVID admission after admission, and I think that what we've seen this year is a bit more of that transition into what we're calling an endemic state of COVID, meaning that it is another respiratory virus that certainly has the potential to cause severe disease, like flu, like RSV, and other viruses in vulnerable people. And we're seeing it layered into a larger respiratory viral season that we really just experienced over the last few weeks in December and early January. But despite high levels of COVID circulating in the community that we've been detecting through various surveillance methods, we really just didn't see that overwhelming rise in hospitalizations. Something much more modest and in line with other viruses.
Well, it sounds like a hopeful trend that maybe as the virus has evolved, mutated, or whatever, has it gotten less severe?
Well, I think it's, it's not certainly to discount the potential that COVID has for people, especially those with chronic medical conditions, those that are older, the potential to cause severe disease. And I saw some of it firsthand this winter, even years into the pandemic and after multiple doses of vaccinations or even prior infections, some people still remain vulnerable. But it is hopeful in that we've seen with continued building of immunity, both within each individual person and across our communities, the impact of it on us as a society is going further and further down.
So some protection from having had it previously or having had some number of vaccine doses. Does that help, even though the thing continues to evolve?
That's right. I think with the updated vaccine recommendations that came out in the fall, what that's really intending to do is catch up our immune system, bring it up to speed, refresh it a bit, so that those of us who would be susceptible to potentially being hospitalized with COVID-19 have a better shot at having a much more mild illness and a more mild course without complications and staying out of the hospital.
Truth be told, I caught it about 2 months ago. I'd had 4 previous shots of the vaccine, but didn't get one in the last year. So my 4th dose was about a year ago. Relatively mild course. It was sort of like having a cold that lingered for 2 weeks. But I know people who had their 5th dose or 6th or whatever it would have been who still caught it.
Yeah, and I'm glad to see you're doing well and in studio again. I think with each successive peak in COVID cases that we're seeing and with availability of vaccines, we're understanding more and more about the relationship between variants as they emerge and our immune system. When new variants come about, it's usually because they either are more better able to infect people. Maybe they're a little bit more adept at infecting the body once somebody's exposed to it, or more likely they've changed in some way to better evade our immune system. But what's continued to remain is that for those of us that are not severely immunocompromised and that are able to mount an immune response to vaccination or infection, we have a baseline level of immunity that's able to recognize COVID and jump into action when we get infected and prevent us from really developing those severe cases like we saw early on in the pandemic.
So how does somebody know? What do you want people out there to know if they come down with cold symptoms?
Yeah.
And it could it be RSV, or it could be COVID, or it could just be a cold? Do you have some underlying conditions? How do you know when to call a doctor, when to go to urgent care or whatever? Because there's a time limit if you're going to be prescribed the antiviral Paxlovid. It's got to be relatively quickly.
That's right, and I think something that's important to keep in mind as well is that there's some data that suggests that the way in which we should interpret some of these at-home COVID tests has changed a bit over time as well. It's more likely that, especially somebody who's received doses of vaccine in the past or has been infected in the past, might actually develop symptoms earlier than their COVID test will turn positive. And so there might be a bit of a lag. And that's in part because our immune system is starting to ramp up and causing symptoms and keeping the virus at bay for a few days before we test positive. So if you think of yourself and you've had that conversation with a provider or a caregiver, you think of yourself as at high risk. When you develop difficulty breathing, high fever, inability to eat or drink, cough that's keeping you up at night, any of these really bothersome symptoms, a call into your primary care provider or caregiver is a good way to do a check-in as to whether or not you need to be seen to have some additional testing performed.
I looked at the state data website, which is still updating, and looked at early January, and 4 years in a row, the number of new COVID cases has peaked. I guess like 10 days after Christmas. We're not outlawing Christmas, right? Everybody next Christmas is going to get together. They're going to have parties. And early January 25, is there any reason to think we won't see the same outbreak and then hopefully it recedes?
No, I think we are seeing a amount of seasonality start to develop. It appears, looking back over the last couple of years, about the week after November or so is when we really start, or excuse me, the week after Thanksgiving in late November, we start to see COVID increase, and then it peaks, as you said, after the holidays in December. And flu, we're really seeing, if you look at the curve this year and overlay it with pre-pandemic flu seasons, we're really seeing it start to normalize once again. So I think this is something we can come to expect year in and year out.
Let's grab a phone call from Montgomery County. This is Shelley. Shelley, thank you for calling. Go ahead.
Yes, I'm concerned because I'm elderly, and I'm worried about the vaccines. Will there be any vaccines available to us and those who are immunocompromised in the near future? Because in the past, we heard that the vaccines are no longer effective after about 5 to 6 months.
Shelley, let's get you an answer. We appreciate the phone call.
Yeah, that's a great question. I think there's a couple of considerations there. One is that it is true that the highest level of protection that you receive from a vaccine in most people starts to wane after a few months. That's the kind of protection that we think of that could really prevent you from getting infected or developing any symptoms at all. But what the data has demonstrated is that vaccines do continue to protect you for long after that against developing severe symptoms. And hopefully research will continue to investigate better ways of developing strong immune responses, covering future variants. We're seeing that right now with research in not just COVID, but influenza and other respiratory viruses too.
Dr. Greg Schrank is an infectious diseases physician, hospital epidemiologist at the University of Maryland Medical Center, and an assistant professor of medicine at the University of Maryland School of Medicine. Doctor, we'll look forward to seeing you next January.
I hope so. Thanks, Jeff.